We're going to spend a little time talking about strokes, the risk factors, warning signs, patient education, but also the difference between a stroke and a TIA. A stroke is also known, or you've also heard referred to as a CVA, or a cerebral vascular accident. You may have also heard it being labeled as an ischemic stroke or a hemorrhagic stroke. So these are all terminologies you're going to learn more about in your pathophysiology class. However, I want to take a little bit of time just to kind of give you an overview so that we know how to best identify when we're doing our assessment of patients, identify signs, warning signs of stroke, and also let's start with just kind of the warning signs and differentiation between a stroke and a TIA. So again, a TIA is your trans-ischemic attack. So these have also been lovingly nicknamed mini strokes. So here is a great pictorial of what a difference is. So TIA is a temporarily blocked artery. So there's a deficiency of oxygen that's getting to the brain tissue itself. However, this is only temporary in a TIA, so you will see temporary symptoms that are relieved as soon as the temporary issue is resolved. So normally you're only going to see any type of deficit, any kind of symptom, sign or symptom that they have lasting under an hour, and then it completely resolves. Whereas with a stroke, the neurological deficit is because of that area of the brain which is completely without nutrients and without oxygen, because there is no blood flow to that area. There are different types, like I said, that you're going to be learning in your pathophysiology, but in this class we're going to focus in on what that assessment of it looks like. So before we do that, we have to identify risk factors, because as we're gathering information from our patients, we need to be able to start filing away some of the items that they're telling us into categories of what increases their risk for stroke. Knowing these risk factors will help you to identify signs and symptoms of stroke early, because you have already started to place a file folder of all the red flags the person might have. So again, collecting that history, we're going to identify these risk factors, so things that we want to identify. Do they have a history or current hypertension? Cholesterol, remember that there's two different kinds of cholesterol. There's your HDLs and your LDLs. And we are talking about high LDLs. So remember LDLs, I think of lousy. So lousy LDLs, L and L, where the HDLs are the ones that actually help bring down the nasty effects of the LDLs. So if they have high LDLs, which falls into that category of cholesterol. Other things like diabetes, AFib, obviously that has a lot to do with the pooling of the blood, and as you've learned about atrial fibrillation, patients that are usually have AFib are on some sort of blood thinner to prevent clotting from happening, which again, blood thinners can also, medications such as blood thinners can also put them at a higher risk for stroke. Depending if it's a hemorrhagic stroke, right, then they're bleeding and you want to stop that, but if the blood's really thin, they're going to be likely to have more detrimental effects and death. So other things like heart valves and coronary artery diseases, a recent TIA or heart attack or stroke. So as you saw in the previous slide, which I'll flip back to really quickly, is that highest risk of stroke within the next 3 months of when they had the TIA. So again, in your history, if they're reporting that, oh, I had a TIA back in February, and let's say that that was, 4 months ago, you know that the likelihood of a TIA being a predecessor or precursor to a full-on stroke, that risk factor is there. The same risk factors for stroking or having a stroke are for patients who are post-MI, so heart attack, myocardial infarction. And then, of course, if they've already had a stroke, it increases their risk factors of having another one. New to the list is your COVID-19 infection. So as you have been keeping up with the latest on COVID, we know that a lot of patients are dying from strokes. So any disease process that has an inflammatory process, such as like lupus or rheumatoid arthritis, those also have risk factors with having strokes as well because of that inflammatory process. Other things like smoking, obesity, unhealthy lifestyle, high saturated fats and sodium in the diet, not exercising. They have a history of too much alcohol in their diet, and even illicit drug use, such as cocaine. All of these things have high risk factors of stroke that are tied to it. But it really doesn't stop there because there's actually more risk factors. So, blood dyscrasias. This makes sense. If you have a blood disorder, depending on the type of blood disorder, it can increase your risk of stroke. You want to make sure that you have a good collection of information about any kinds of blood dyscrasias, as well as a family history of any blood disorders, because we want to know that, as well as a family history of strokes and TIAs. We know that that increases the risk because there's a strong genetic component to it. Sleep apnea is another one, increases the stroke risk for stroke. Other medications besides blood thinners, you have estrogen, so hormone replacement therapy, or those that have been on or are currently on birth control pills are at higher risk for strokes as well. We know that pregnancy and about a week or two after giving birth increases the risk of them having a stroke. So we want, and especially if during pregnancy they have preeclampsia, which you'll learn more about in your OB class. But we know that during that time there's a high risk of stroke that is associated with those that are pregnant and immediately postpartum. Other risk factors that have been linked to increased risk of strokes, you have high levels of stress and anxiety. Couple that with not sleeping well, because usually people who are dealing with a lot of stress and anxiety aren't sleeping very well. But those that have poor sleep, know that age, as you get older, your risk for stroke factor or risk for stroke goes up. And interesting enough, men actually have more strokes than women. However, women, because women live longer, there's actually a higher rate of strokes for women. So it's a really interesting thing, but basically men and women, both risk factors, okay? And then, of course, working and living in air pollution is a big factor as well. There have been some ethnicity studies and ties to different ethnicities having a higher rate or a higher incidence of stroke than others as well. However, these are, of the last two slides, these are some of your big ticket items and things you need to be thinking about. So that good collection of history is very, very important to know the risk factors of stroke. So what are the warning signs of stroke? So we have some big ticket items, right? These are your red flags. These are things that you're looking for in your hospitalized patient, or maybe your patient that it's coming into the ED. But remember that strokes can happen anytime, anywhere, but they are always sudden. They are never progressive, okay? So strokes will happen suddenly. So you will notice the commonality between all of these bullet points is the word sudden, okay? So warning signs of stroke that you need to be aware of as a nurse. Sudden numbness or weakness. You can see it as a facial droop. You can have them squeeze your fingers and you notice a deficit on one side or the other that wasn't there. Sudden confusion or sudden not being able to respond and get the words out. Maybe they're slurring or they look confused, or they're having a difficult time understanding you. Again, this is all sudden, not gradual onset, but sudden. Sudden trouble walking, or they have difficulty with balance and they are just super dizzy and can't even hold their head up. Loss of coordination, the sudden vision changes. So all of a sudden they're like, I am seeing two of you, or this can happen in both eyes or just one eye, depending on where the stroke could be happening in the brain. And then one of the biggest ones here we've talked about with head, eyes, ears, nose, and throat is that the sudden severe headache. So a thunderclap headache, meaning that it came on suddenly like a bolt of lightning. That they report it's the most severe headache they've ever had in their life. These are warning signs that they are currently having a stroke. So you as a nurse need to be very, very aware of these. But as we're discussing with the patient, we need to be able to provide patient education, and that's a lot. The warning signs of stroke is a lot to digest. As providers, we can remember things of that nature because we're doing these full assessments on our patients. However, patient education, we want to be able to send home the family and the patient with information to be monitoring for this, because your stroke patients are eventually going home, right? They may be going to rehab, but they're still going home and somebody's monitoring them, in the day they're with them at night, or somebody that's just had a TIA, that the risk of having a stroke in the next 3 months is pretty high. So you want to be able to educate your patient and the families. So vsTIA is a great acronym to be teaching your patients. So you would teach them vsTIA. Each one of these letters stand for something. So the B is balance difficulties. E is eyesight, so changes in the vision, right? F for fast is face. So all of a sudden they have a facial droop. Or a weakness, or if they don't look symmetric, you're looking at them going, something's not right with your face, right? Sudden arm weakness, so they can't lift their arm up anymore to do things with it. And then speech difficulties for S, and then T, time to call 911. So again, this is a really great tool to be using for patient education, for educating them on signs and symptoms of stroke and what to look for. Okay. So again, in this presentation, you've learned what the difference is between stroke and TIAs. You've learned about the risk factors of strokes, as well as warning signs of strokes and how to properly educate your patient. Please let me know if you have any questions.